to our board meeting, to all the board members, as well as our senior management team that's here as well, and then for those who will be viewing from the comforts of their home. Welcome, everyone, and I'm going to ask for agenda approval, and but prior to that, I would like to include two items. One, actually, it should be the very first question, and this is from Tracy. Section 22 order to agribusiness being, the Southwest Public Health versus the We Choose Section 22 order. Because of litigation or possible litigation, this should be an in-camera discussion and under Section 239 of the Act. And then the other, we will put it under new business under 9.2. If you want to put 9.2, that would be water testing and utilizing a third-party contractor. So on the agenda approval, could I have a motion? Thank you, Tracy and Ed. Sleeman, all in favor? Any? That motion carried. For the members, is there any conflict of interest on the agenda as presented to you this afternoon? I hear none, so we'll have that reflected in the minutes. So we'll move on to item 4, which 4.1, the COVID-19 update, and I'll call upon Dr. Ahmed to give us an update.
Thank you, Mayor McNamara. So as of today in Windsor-Essex, we have 1,857 confirmed cases of COVID-19. We have reported 69 deaths in our region. Resolved cases from our region right now is close to 1,250 cases. We currently have 6 workplace outbreaks. Out of these, 1 workplace is a manufacturing sector in the region, and 5 are farm agricultural farm industry in our region. And within the agri-farm sector itself, we have 143 active cases, and we're still following a large number of contacts from these farms. Our ongoing challenge is still some cases.
Can I get everyone to, except for the speaker, to mute your mics, please?
Okay, maybe this is better. Okay, so one of the in terms of the agri-farm sector itself, we have 143 cases that we are following up daily, and we have got close to 100 contacts that we are following as well. Some of the key farms that we are still dealing with is right now with it's 4 farms that have most of the cases. And they're all in have active cases that were already known to public health, and we've been working with the farm for some time right now. They have multiple locations, so at times when we have these cases, we are working with them to find a solution for them, including any need for isolation and accommodation for all those individuals. So those conversations are happening daily by our team. With their senior leadership, their president or CEO, directly with myself and Teresa, pretty much every week and as needed. Some of the farm had some ongoing conversation every other day, so we're doing that. Other than that, the community cases continue to be low in our region despite our stage 2 reopening. We are still seeing some cases as a result of close contact, and our messaging has been very clear to reduce the number of contacts despite us moving into stage 2. It is also very important for us to keep that close contacts at the minimum and continue to follow the measure that we are following right now to be prepared to move into stage 3 when there will be more businesses opening up. So it's just some of the messaging that we've been working in the community just to remind them about some of these needs. From an agri-farm sector perspective, there's a lot of movement that's been happening. There are a number of partners that are working together to build a coordinated system that could support all these testing as well as accommodation need of these individuals. Canadian Red Cross is also supporting at least 2 hotels in the region with all these workers that needs self-isolation. Our team has been participating in all those conversations to provide our public health perspective in these discussions. There are a number of efforts that have been currently happening with the province, including OMAFRA, Ministry of Labor, Ministry of Health, Ontario Health. We have been, Teresa and myself, we are talking to the ministry office, the Office of the Chief Medical Officer of Health every day with the farm updates and giving them up-to-date information, what they need for further discussion at the ministry level with other ministries. So that conversation is also happening. We feel that it's just it's in the process right now, but hopefully in the next couple of days we'll have a good, strong system in place for the isolation of anyone who needs isolation for the agri-farm sector. Our work will continue with the outbreak and case management, and there may be some new initiatives launched by Ontario Health for worker testing in the next week. Can't hear you, Gary.
Yeah, that must be better. Yeah, I tell everybody to mute, including myself. But with that, thank you, Dr. Ahmed. Any questions, members of the board, to Dr. Ahmed at this stage? The only question I have, Dr. Ahmed, is I know we've got some resources that came from Chatham-Kent and also from Middlesex Public Health, and that are they still here on the ground helping us in the testing and on the Margaret Farms?
So we have Dr. Alex Summer on the line as well. He's the Associate Medical Officer of Health from London and was sent down to us by the ministry to support us in our work. So he's on the call as well, and he's listening, and he was helpful in reaching out to at least some of the farm to develop some, to do more in-depth assessment of these farms and to develop some protocol that help them. In addition, Alex came in with a couple of his team members that helped with the case and contact management of the largest farm outbreak that we have seen. And as a result of all of that, we created a document for the outbreak management, case and contact management for agri-farm sector that we have shared with the ministry, and the ministry is planning to use that document as a tool to share with the rest of the province based on the work that we have done in Windsor-Essex, and Alex and his team supported to put it all together in a document form. In addition, I think there are other health unit staff that are coming here, and I think there's another item Teresa is identifying that she'll speak to it for the rest of the support that we are receiving.
Okay, well, thank you. I don't want to steal Teresa's thunder, and her. But anyway, thank you for the report. But I certainly, at this time, on behalf of the board, I want to thank Dr. Summers for for your help, and I know that these are unprecedented times, and unfortunately for us, or fortunately for others, this is Foodland Ontario. We feed not only our community, but we feed the province and the country, and we certainly are very thankful for your help here, and plus your staff that you've brought with you, from the Middlesex London Health Unit. So. It's a heck of a way to be introduced or welcome into our community, but certainly we appreciate everything that you're doing to help us, get back to getting those farms in a healthy future. So thank you for your efforts.
Pleasure was mine. It's a wonderful team at Windsor-Essex County Health Unit, and a true privilege to work alongside them. So thank you so much.
All right. So if there's no further questions or comments to Dr. Ahmed, thank you, Dr. Ahmed, for your update. Members of the board, we on 5.1 we have the regular board meeting minutes of June 18th. Can I have a motion to receive those minutes? John and Joe, on those minutes, any errors or omissions? I see. You got your hand up?
Yes. The minute had been revised somehow. I was talking to actually to Teresa, and we revised them. Just small error. So if we move the minute, we move the revised minute.
Okay, I will identify that as amended. So that's okay for the mover and the supporter. And then good. Okay, as amended. If there's no further questions or comments, then all in favor? Opposed, if any? The minutes carried. Thank you. Any business arising from the minutes? I hear none. So then we'll move on to the consent agenda. We have actually two items. If I could have a 7.11, 7.12, the June communication recap, effect of climate change and invasive mosquitoes, the Zika virus, and migrant worker health, Windsor-Essex. Could I have a motion to receive those two reports?
Move.
Moved by Ed and supported by
Tracy.
Judy. Any questions or comments? We heard none. To Christy, is there anything that you want to highlight from that report?
Nope, all done.
Okay, then all in favor? Opposed, if any? That's carried. Move on to 7.2. We have a recommendation report, 72-1, 2020 budget amendments, and that's presented by our CEO, Teresa, and our controller and treasurer, Lori.
So I will start. The report is in your package, and it's a recommendation report for the amendment to the 2020 budget. And I'll just give you an overview of what is in the report, and then Lori will come in when we get to the actual financials. So on March 20th, our health unit received their first case of COVID-19. And to date, we have 1,857 cases. And we have had 69 deaths in our community related to COVID. In addition to COVID, we continue to have unique challenges in our health unit, which we are related to the many inspections that occur in migrant farm operations. We have between 8,000 and 10,000 temporary foreign workers that come to the area across 176 farms. Our health inspectors inspect these farm bunkhouses, and to date they have inspected over 900 of these bunkhouses. And in addition, we have 44 long-term care homes and retirement homes. So over the course of the pandemic, we have had outbreaks in long-term care, retirement homes, and now we're seeing outbreaks in actual migrant farms. Since the beginning of the pandemic, we instituted an IMS structure and seconded many of our staff, approximately 80 of our staff across varying roles, to assist with the response to the COVID pandemic. And at that time, under the emergency orders, we were able to deploy staff across different schedules, different programs, and really devote our resources to the protection of our public during this pandemic. In May, you'll see under the background, in May, the ministry did ask about our ability to respond within 24 hours, to follow up with cases and then contacts. At that time, when we responded to the ministry's questions, we had 656 cases in our community. And at that time, we were stretched thin. We knew that as COVID progressed, we would not have enough staffing to continue on with the requirements that were required for demanded through this pandemic. We made decisions under the Medical Officer of Health and the emergency order to defer or reduce our programming. And you'll see on page 12 that this included school-based immunizations, oral health programming, health promotion programs, vaccine distribution programs, routine inspections to physician offices, healthy families programming, the non-critical visits, breastfeeding support, food safety, and training, the food safety courses. As well, we used our existing staff in epidemiology, IT, communications, planning to develop in-house resources and supports to produce a whole electronic charting format for our nurses to follow case and contact management and all of the other staff that were seconded for COVID. At the bottom of that page, you get a little bit of an overview of the number of staff that were seconded, 8 managers, 2 nurse practitioners, 35 nurses, 7 RPNs, health promotion specialists, dental hygienists and assistants, our epidemiology, clerical staff, public health inspectors. And we shared with the board before, we had 2 shifts going 7 days a week, and continue to work 7 days a week and to meet the needs of this program. It was early, well, maybe the last week in June, we did reach out through our public health mutual assistance agreement, which is on page 13, to health units under that agreement that are in our area: Chatham, Sarnia, Southwest, Grey Bruce, Huron, Perth, and Middlesex, London. And we received support from various health units, which also required our staff to onboard these nursing staff and others through our HR department and through IT to introduce them and orient them to our system. And they are assisting. We have about 11 full-time staff and I would say about 10 casual staff that are currently assisting. In addition, and as already was spoken by Dr. Ahmed, Dr. Alex Summers attended on-site with 2 of his staff for the past 2 weeks and continues to support us remotely for this next week or so. And he came at a strategic time because of all of the work on the in the agri-food sector and the farms. So with his help and also the help of PHAC, they have seconded a field epidemiologist to work with our epidemiologist. We just wrote a request to extend that support for another week, which they are contemplating or considering. And also Public Health Ontario's has been helping us with our IFAS data entry, which is necessary for the pulling of all the data to make sure that all the stats are correct as reported by the ministry. And at the bottom of page 13, you'll see that the Emergency Operations Center was also accessed through the migrant farm outbreaks that we're dealing with. So as we move into the remainder of the year, and with COVID still very much the priority for our health unit, we are aware that the province is slowly reopening, and as everything reopens, that continues to be a burden on, not a burden, but it also is competing with the needs of the pandemic. So in particular, our health inspection department and our nursing departments are being stretched right now because all of these resources are going to the pandemic. So you will see on page 14, we have a proposal, and this is where I'm going to bring in Lori in a minute here. And we are asking for assistance for the Medical Officer of Health with a full-time Associate Medical Officer of Health, a manager for a specific COVID response team, clerical support, public health nurses and registered practical nurses, public health inspectors, and an epidemiologist. This we feel would help support the continued response to COVID and also help meet the needs that exist and all of the other work that we will slowly be reintroducing to our public and to the, to our health unit. So I'll ask Lori to come up and go over the actual figures and what this means, and we'll go from there.
All right, so
Thank you, Teresa.
midway through page 14, we have compiled an operating budget for what would be from roughly the beginning of September to the end of fiscal 2020. Total operating costs for these 22 FTEs are anticipated to be $857,329. These FTEs would be deployed to work from home, so the costs that are accumulated here do not contemplate any sort of infrastructure such as desks and equipment that outside of IT equipment that they might require should they have been located in the office. From a funding perspective, on the bottom of page 14, I attempted to quantify the financial impact to the obligated municipalities for the remainder of 2020 on the assumption that the Ministry of Health does not fund any proportion of these FTEs. So from the City of Windsor's perspective, it will result in an additional $466,726 worth of contributions for the year. For the County of Essex, $390,098, and for the Township of Peely, $505,000. On page 15, and on the presumption that the ministry does come forward with money specific to this particular initiative, if we use the funding allocation of 70%, 30%, that proportion borne by the obligated municipalities would decrease to overall $257,200 for the remainder of 2020. For the board's information on page 15, I included an additional operating budget of what this would look like on a complete annual basis, this entire team. We would look to see an increase in operating costs of $2,208,953 had this team been implemented at the beginning, say, of 2020. The resulting impact under the two scenarios. So under the scenario of the municipalities would bear the complete burden, that $2.2 million would fall to each of the obligated municipalities at a rate of $1.2 million to the city, $1 million to the county, and $1,301 to the Township of Peely. If however, the ministry were to provide funding again on the 70-30 basis for that annualized amount, those costs would, the increase in obligated contributions would go to $662,686, broken down to $360,000 by the city, $301,000 by the county, and $390 for the Township of Peely. So before I move to page 16 of the report, do any of the board members have any questions in regards to the figures that I presented?
Go ahead, Tracy. Ed.
Thank you. Through you. I'm assuming that the business case has been submitted as well to the Ministry of Health so that they can utilize any surpluses that have resulted during this stretch and reallocate resources over. So the business case, I guess the question first is, the business case has been submitted to the ministry?
Yes, so the information that you do see presented, and there's aspects of this report, has been submitted to the ministry. It was submitted in the beginning of May. There have been some minor modifications from our perspective, and in particular surrounding the budget piece that we have made, and has resulted in an increase from what we had previously submitted to the ministry. But yes, we have done so.
Excellent. And so it's my understanding that there certainly is surplus available for reallocation. Do you have some sense that there will be some resources coming your way to take the pressure off the municipal dollars needed?
So based on my understanding of some preliminary communications from the ministry, there was a letter disseminated to health units regarding extraordinary costs and that there would be some sort of request at some point during the year requiring us to accumulate and submit those costs. I do not have a full understanding of what they're going to define as an extraordinary cost. But I presume there will be something at some point this year.
Excellent. Well, you certainly have my support on the proposed motion to move forward. Absolutely needed. And the only regret is that we haven't moved faster with getting some more of these resources, and the ministry hasn't already been more proactive on sending some resources down. So thank you very much.
Okay, thank you, Tracy. Ed?
Yes. I think my question about the Associate Medical Officer of Health, was there any serious discussion with the ministry if it's going to be permanent or it's going to be at least just for the pandemic time we have right now?
Teresa, did you want to speak up?
The ask is for a full-time associate medical officer of health, and because the work of COVID will not go away after this year. COVID will be here to stay, and also the infectious disease program, based on what we have seen the past few years, is that there are greater needs in that area, and with having Dr. Ahmed as the sole medical officer of health, their request is for a full-time, ongoing associate medical officer of health.
Teresa, if you recall, when Dr. Kirk used to be here, we were contemplating of getting an associate medical officer of health to be like a permanent position. And after that, I don't know what happened. We didn't pursue it. So do you think it's an opportunity to get an associate on a permanent basis?
Well, that is the proposal on the table. We are recommending additional support at that level. And, for a health unit this size and the unique challenges we have, an associate dedicated to COVID and infectious diseases is in the best interest of our community.
Mm-hmm. Mm-hmm. Okay, thanks, Teresa. Thanks, Gary.
Okay, thank you, Ed. Reno, I think, is on the phone.
On Tracy's questions as far as the funding conversations, I mean, there's a lot of conversations happening, obviously, with municipalities through AMO, FCM, all kinds of support programs. I'm hoping and assume that this could be something that the discussion, you give us two potential outcomes or realities, and one of them is without the province contributing at all. I'm hoping that we could actually get it the other way. Do we see or foresee, maybe not from the Ministry of Health themselves, but rather from the province through discussions in any capacity, and maybe the chair could comment on this as well as from the warden's position, conversations where this shortfall, this deficit could be made up by support either from the provincial or even federal governments through some relief program.
Well, I can weigh in on that, Reno. Yesterday, I took part to the Standing Committee on Finance, and I was on with the committee for about an hour with other mayors, and I can tell you where on the government side and even on the opposition side, the questions were coming. What can the government do to help relieve the financial burdens of COVID-19 on the municipal sector? My answer to them was pretty clear, that we finance health units, land ambulance, and many of the affected COVID-19 areas. And if the provincial government wants to soften the burden on municipalities, that they should come through and fund additional dollars to the health unit. That would be a huge help for certainly the municipal sector, because this is the ground. I said we're the ground troops. We're here taking care of the four corners of the municipality, and public health is the foot soldiers that deliver on behalf of the provincial government as well as us, or the municipality. So the answer is yes. We are asking them, and the second part, in terms of the federal government, as you know, FCM laid out a $10 billion ask to the federal government to help municipalities. I know the province is, it's a bit of a stalemate right now in negotiations with the federal government. And I think, rightly so for the province, they want at least 38% of that 10 billion, because that represents 38% of the population, right? And so they're continuing some negotiations, federally. So yes, we AMO is also asking for relief for public health for the municipal sector, and so we're basically at the hands of the provincial government moving forward. But it was pretty clear. I mean, from Northern Ontario to others in other jurisdictions in the province, one of the key asks was to help fund the additional requirements for public health.
Okay, thanks, Gary. I guess, and the second question, just a clarification: the 800,000+, is that a total surplus? Because it looks as if that's just the program of hiring new staff and new personnel for the remainder of the year. Do we have any indication what our overall deficit will be by the time we get to the end of December?
So, Reno, we're actually currently working on that estimate. We had prepared an earlier estimate, and I believe it was around mid-May, and we had anticipated being roughly $1 million in the deficit. Now, I will say, though, that million did factor in and did contemplate a team such as this, but again, probably not as large. It was more based on the initial business case we put in, but we are currently attempting to look at the June month end and take that information and extrapolate out to see what we will finish. So I'm hoping to bring that to the board in the near term to share what we anticipate the deficit to be.
All right, thank you. Mr. Chair, just for ease, so I don't have to interrupt again, I don't know who has the motion, but I want to put forward a friendly amendment now that just basically stipulates that supporting the motion, but also supporting a motion to get the final deficit numbers, including this ask, to the county and to the municipalities as quick as possible, and also ask that those municipalities write a letter to the province and to the Ministry of Health for financial support for the shortfall.
Yeah, just to let you know, Reno, there hasn't been a motion yet. I believe there's been some one that has recommended it, obviously, and I would surmise that Tracy would be prepared to move it, and so with those additional asks, I think they're very reasonable, because that's exactly what AMO and MFOA and FCM and certainly the municipal sector are asking. So I think those are very good asks, and there's no doubt as well that municipalities, we've got to continue to push the provincial and federal government for assistance, because this was an ask by the majority of the municipal sector. Any further? Is there any further questions on the report? I hope somebody, Leanne, did you track the exact request that Councillor Bordelin brought forward to amend the proposed motion?
Yes, I did.
Okay, so if there's no further questions on the request, and that I'll turn it over again to Tracy. So you're prepared to move the recommendation, and I believe Reno, you're ready to support.
So, Mr. Chair, I'd just like to point out one thing. There's a minor error in the motion. It was supposed to be 22 FTEs, not 19 FTEs, to remove reflective of what was documented in the report. So my apologies.
Okay, 22 versus 19.
Yes.
Okay.
And yes, I support Gary.
Okay, thank you very much, Reno. If there's no further discussions or comments on the request, all in favor? Opposed, if any? That's unanimous. All right, so we'll move on. There's no board correspondence. New business, we've got two items. We've got the addition, and which would be the water testing, and the COVID-19 task force. And I believe, Teresa, you have the floor.
Thank you. So this occurred last meeting, and I believe it was in committee of the whole, that the resurrection of a COVID task force with members of our board should be in an open forum. So we are bringing it back at this meeting to again consider the COVID-19 task force with members of our board, and have a motion that supports that. So based on the last meeting, it was our executive board committee of John Scott, our board chair Gary McNamara, and Tracy Bailey, with the addition of Councillor Reno Bordelin. So that would need to be a motion in the public forum.
Okay, thank you, Teresa. All right, I need a motion to move the recommendation for the COVID-19 task force. Fabio and Ed, on the motion, any questions or comments? You heard none, all in favor? Opposed, if any? That is carried. I see, okay. So we'll move on to 9.2, which is this is the add-on. It's the water testing and utilizing a third-party contractor.
Thank you. So we know that this was one of the items that needed to fall off because it was too challenging to continue to conduct that. But what it means to municipalities, and there is a letter that will be forthcoming from Lakeshore, and I know that Essex had some concerns with it as well, and has taking their testing on their own with Colchester Beach. So at this point, I guess I just want some clarification, and I'm hoping that the board will support moving forward in some way with the assumption of our responsibilities. The beaches are unsafe. We know that there's unsafe conditions of E. coli in some of our beaches on a regular basis, and it's quite a challenge. The other barrier for municipalities is the communication pathways that are so well done by public health that really municipalities don't have a mechanism for. So they can go to other companies and contract out to Aqua and other things, but communicating the messaging out in the way that public health does isn't something that they're familiar with. So I'm wanting to put forward at this time that we consider fulfilling our responsibilities, and that if we cannot do them internally, that we contract them out, and potentially, I understand the shortfall of those resources would need to fall upon the report that we just watched a minute ago, but I do think that ability. I also recognize that some of the beaches are closed, so maybe there is some way to do a summary of which beaches are going to be open and shortlist them and still fulfill that. So I'm interested in hearing from other members of the board and see how others are feeling about it, and in particular Essex, that has just gone through this experience as well.
Okay, thank you, Tracy. Any questions or comments from board members? Go ahead, Ed.
Yes. Can you hear me?
Yep, loud and
Okay.
clear.
I'm just wondering, my question should go to Dr. Ahmed. Why, in the first place, we suspend the water testing or the beach testing? What is the reason for that?
No staff.
Thank you, Councillor Sleeman. The main reason for discontinuing the beach testing is about the resource. With the COVID-19, our inspectors are busy in following up with all the long-term care homes and retirement homes. That work has grown significantly in terms of the follow-up that we are doing. Up until last week, our inspectors were reaching out to each of these long-term care home and retirement home every day, and to support them in their prevention effort to ensure that there's no new case of COVID-19 is introduced in those facilities, and also to provide them with all the support from an infection prevention and control perspective and outbreak management perspective. So they are really supporting that. With the opening of stage 2 and many of the businesses, restaurants, and other places, they are also trying to support those businesses to keep open in a safe manner. So a significant amount of time and effort is going in there. And also, last but not the least, is the enforcement activities and the education that they are doing with Section 22 delivery to individuals if they're not compliant, businesses if they're not compliant, reviewing some of the requests that we are getting from all the businesses across the county to look at their plans, proposals, visiting, doing site visit, all of that. It's been done by the public health inspectors, and really it was just a matter of resource, and we didn't have enough bodies at the health unit to provide that. We use that approach knowing that beaches is something that obviously it's a snapshot again. When we are testing the beach on Monday, by the time we get the results on Tuesday and Thursday, the result is already dated. So based on some of those consideration, we felt that if we have to prioritize the activities, this is something that maybe we can defer and put some signage like we do in some of the other beaches to swim at your own risk, and the beach is not monitored. And this is something that many of the other health units are already doing, in the sense that our health unit is probably some of the few who are doing our own beach testing. Many of the health units do not do that. But again, we have a lot of beaches in our region, which makes us unique.
Dr. Ahmed, I think you gave me a lot more than what I asked. I want to thank you very much.
Just a question to Teresa or Dr. Ahmed. When the samples are taken, from the beach and that, are they sent to a lab for analysis and then back? And then I've got a follow up from that question.
So it goes to our public health lab, and so they do our beach water testing. And just because of the nature of the testing, it takes them 2 days to give the result.
With the, I'm just trying to find ways, to and I understand in terms of the how strapped we are in terms of the numbers and dealing with COVID-19 and that. But is there an opportunity through the Canada Summer Program, biology students from the university or college? Because right now you can have there's an 8-week program, and I'm sure that where it's basically it's paid over 100%. It's a matter of somebody physically going and getting the samples and bringing them to be tested. Is there an opportunity? And if there is, maybe a phone call to MP Kuzmerzik, for some support.
So in the past, we have used students, and we continue to use students for some of our activities, primarily the mosquito surveillance, which, as you know, with the albopictus in our area, we do enhanced mosquito surveillance as well as the West Nile virus. So the beach sampling testing program not only includes our own public health inspector staff, but in the past we have done it with students as well. And we also work with our epidemiologists, because all of the information that gets returned to us, all the samples, gets tracked, and then as our board member stated, Tracy Bailey, that the communication piece is part of all that too. So it involves our communication people, our website people. It's not only the administration of the sample. We brought this forward previously because we knew that it is a time-intensive, resource-intensive part of our summer activity, and it will continue to be, even with students. We still require an experienced public health inspector to oversee the program, and in saying that's how it is. And the program also, if there is a sample that comes back and access it, rather than close the beach is closed for a period of time, and resampling is done as well. So to say that it can easily be done with other people, not easily. It's taking resources from other areas as well. So it was all truly using the Emergency Management and Civil Protection Act to, prioritize first services that we thought would help us, but also be able to give the municipalities the ability just to post the signage, as Dr. Ahmed stated.
Okay, thank you for that. Any further questions or comments? Go ahead, Tracy.
Got it. Question for administration. So if this was something that the health unit decided to contract out to another body, for instance, Aqua or someone else to do it, how challenging would it be to maintain the communication piece back out?
So the communication department, I'll just provide a little context with the COVID. We actually have taken in one of our directors to oversee the communication for COVID. So again, all of our resources have primarily been dedicated to COVID and essential communication. So we would move forward with what the board is asking, but it will come at an internal discussion about what then do we not do. And as the province reopens, it's becoming very difficult to go any leaner than we are. We have programs across all of our health units that have been very, we're providing minimal service. Earlier this week, Dr. Ahmed talked about us resurrecting our full dental services, where we have 1,500 people on a waiting list. And some of our dental staff, 11 of our dental staff, have helped with COVID. So as we pull those dental staff back to dental work, that leaves the gap in COVID. So it's that fine balance of making it all work, and it has been an ongoing resource issue for our health unit, but we can investigate more.
So at this point, through the chair, I will put the motion forward. I think it's important that the motion goes forward and that we make a decision as a board to either move it forward or not, but we need to make sure that the municipalities that have beaches understand that it either will be conducted or won't be conducted, and that the board has ruled on that. So I will put the motion forward that we resume testing or contract testing out.
Okay, thank you.
I think we should.
That has been moved. Do I have support on the motion as presented? Hang on a second. I'm conversing with those on the phone here. Okay. I believe Reno is trying to chime in.
Thank you. I'm just wondering, I understand the desire, and I believe I asked it last meeting because I do think it's a valuable resource. My concern is that the people, or as Dr. Ahmed and Teresa just mentioned, we will, if we approve this, we're displacing something else. Would Tracy consider an amendment or even something like a deferral where we understand what's getting displaced before we support this? My concern is that something else gets displaced that we are putting in jeopardy, and then it just becomes a domino effect of wanting to cover that, and until we actually have the resources, unfortunately, there will always be something that gets displaced. So my concern is I don't know what this is displacing before I support it. I'd like to support in principle, but I also understand that we have finite number of resources, and I don't know what we're displacing before we support this. So I don't know if there's a way to consider that in the motion at all, but I'd like to see what staff says we're displacing, or if we could somehow accommodate it without displacing or making quite that much of an impact. That would actually be great.
Thanks, Reno, for that. That'd be my, I guess my concern as well is that even in the previous report, now when we looked at 22 add-ons to our staff just to deal with COVID and many of the other issues. Yeah, you certainly don't want to water down whatever other services that are deemed important. They're all important, and I know of any summer that the beaches should be open is this one in particular. Has been so hot and so forth. But again, when staff is being required to work 7 days a week and to meet the challenges of this pandemic, that certainly creates a bit of an angst in terms of how we reduce or pull from resources that we know right now are struggling to meet the challenges of dealing with the COVID-19 and that. But I do believe in terms of what Reno is stressing as well is that if you can, I guess, continue the conversation and to see if it makes sense to. I firmly believe it's contracting out is if anything was going to happen, that would be the way to go, because I think pulling our staff to deal with the service itself. And I'm glad explanation. It's not this person taking a sample. It's all the other requirements that would be pulling those resources from COVID. And so in terms of what Reno, I think that's a good compromise or amendment. And then, but at the end of the day, we have to understand that we can't afford to lose any support on COVID-19.
Question, Gary?
Go ahead, Ed.
Yes. Like I know we've been dealing with it without actually knowing what is the cost for that program to be resumed. And I know you were talking, you said if we initiate it, we may have to delete some of the program. But we just want to know briefly what the cost will be to resume the testing, whether it's done by the health unit or by contractor. I wonder if Teresa have an idea, or Dr. Ahmed might have an idea about the cost.
Well, the cost right now we do internally and have in the past with the help of students. So all of that has been accounted through our budgets previously. So I don't know what it would be to contract out. We would still, I would have to look at this, but it sounds like the contracting out would be only the piece of the actually going to the beaches and securing the samples. So everything else still would have to be performed by our health unit. So I don't have the answer to that question right now. I'm trying to figure it out, but
I was looking for a simple answer about the cost. If it doesn't cost that much, I think Tracy, she have a point bringing it up, but how could we vote on something we don't know what it is? So, thank you.
What I'm gathering is the service itself. It's really embedded into the health unit. We can take pieces of it, but it still involves a certain amount of expertise within the health unit itself. Yeah. Am I correct in saying that, Teresa or Dr. Ahmed?
There are protocols and standards on how to take the sample, and there's procedures and getting it securely to the lab. Like all of that is, it's done by our public health inspectors or public health students that are, trained to do that. It is a role of a public health inspector. So, we would have to look into how that can occur. I know that when we did even recruit public health inspector students for our West Nile virus and our Aedes albopictus surveillance program, that we got the students very early on because they're in high demand across other health units as they utilize the students because they are, they come at a more reasonable cost. So the students that we do have in place are being used for another program. And in the past, we've used our own staff supplementing what's needed. So you're right, it's embedded in the program, the work that we do. It's part of that health inspection department, environmental health, that have been very key people in this pandemic. So.
Okay. The only other what I was thinking is samplings. I know that our municipalities, our water divisions, we sample water every day, and we know how to successfully take the test in that. But it still wouldn't change the fact that even if municipally our water divisions would sample the water and have it sent, which we do, on our under the Safe Drinking Act, and but the other aspects of what's embedded within the service would still be, the health unit. I suppose it would be involved at some point. So once you get the results back, they have to be obviously reflected, monitored, and communicated, and so forth. So that would still require our staff.
Well, it would make sense that it has to come back to the health unit for all of those pieces. And I want the board to know that we did, all of our health inspectors did the assessment of all the beaches. There is an initial assessment at the beginning of the season, and that was completed. And the beach season typically begins in May, and we finish off in September. So.
Okay, go ahead, Gary.
Mr. Chair. I like what Tracy's saying here. We've only got 6 weeks really left in the summer here. July the 16th to about August the 30th. I think there's some way that we've got to get our health inspectors to do this remaining 6 weeks. As the chair alluded to earlier, it's a very hot summer, and the forecast is keep going like that. So I think for 6 weeks, I think it's a good move moving forward, and I'll support her motion.
Me too.
Okay, thank you, Gary. Joe?
Thank you, Chair. In terms of the request by Tracy, it's a fair ask of the health unit, and a decision needs to be made. So, if we go in one direction or not, the municipality at least can inform its residents. I think Dr. Ahmed articulated very well where most health units are posting signs, swim at your own risk, that those tests are basically timed. So if they do the test the Monday, by the time it gets reported, by the 2-3 days passes, a lot of things can happen. And so that false sense of security, even as a parent or as a family, if I go to the beach, it's a swim at your own risk, and that's how it's always been. My concern is, COVID is a priority, and unfortunately, beaches are open. They're not closed, but it's swim at your own risk. But looking forward, you got to look at what's coming down. We haven't even talked about September, where school. There's going to be a lot of involvement by the health unit to have to approve all the school board plans early August. That's going to require a lot of time on them. And again, the Ministry of Education just given us the bare bones of what September may look like. So the month of August, I could see the health unit involved in approving plans of school openings, hybrid models. You throw that in the mix, what's the priority? If we're all hands on deck and we're asking people to help us with testing, to me, a beach is a leisure activity. It's one of those things that, unfortunately, the arenas are closed. Those are activities that most people have to understand that we have to put our hands on deck on the priorities. And I think the administrations, as they've said that they're 24/7 with the COVID pandemic, and trying to deal with all the things that are coming at them. To throw this into the mix would require more resources. So if there are options, perhaps looking at like Gary, you mentioned the towns doing their own testing, it still will involve the health unit. So at the end of the day, I like Reno's suggestion is what's going to take effect. So at the end of the day, does the health unit need to hire more? And if that's the case, there's a cost to it. So again, I do like it's a fair ask. However, I think right now we've got our hands full, and we have to really be careful what comes up in the next month or so. A lot of unknowns there. So thank you.
Okay, Judy, and then Fabio.
I think, can you hear me?
Yep.
So I guess I would say, again, I agree with Joe and Reno. I think that without the cost and knowing what it's displacing, I think that it's something we all would like to see. But I think that we have to look at priorities. We're already increasing and looking at increasing the budget and more resources to COVID. And unfortunately, we don't know how much the province is going to cover of that. That's going to fall to the municipalities. So I don't think at this point I could support the motion without knowing the costs and what it would be displacing and what's the priority. I think we have to look at the priority of all the programs and see what are the costs and implications and staffing before we pick off one program at a time.
Thank you. Fabio?
So thanks, Gary, and thanks, Tracy, for the question. I have very simple questions for administration, perhaps Teresa or Dr. Ahmed. If you can just answer in the simplest forms. If we go ahead and do this, are we taking resources away from COVID? Yes or no?
Yeah.
And is this a priority over COVID, or is COVID a priority over this? I mean, this is a leading simple question. But in terms of priorities, and I'm deferring to the expertise of our staff, and you guys are in the operations every day. What's the priority here? I need to understand. Can this be done with COVID or not?
In the emergency act that we are now has been extended to July 29th, it says that the health unit can cancel or postpone services that are not related to responding to or preventing or alleviating the outbreak of the virus. All of our resources are going to the virus or slowly
For some
opening
reason-
up other essential
And could you
services.
mute your mic? Sorry about that, Teresa.
But the same order does say, it continues, or services that are not deemed to be critical by a Board of Health, business continuity, or pandemic plan. The emergency order talks about the reallocation of resources and prioritization for COVID. And our health unit continues to work with many farms across Essex County to try to decrease the transmission of COVID. And that includes our nursing staff, our public health inspection staff, and our management staff. So that's the answer. It will take away from COVID.
Okay.
Everyone is helping.
Thanks, Teresa. Thank you. Chair, can we call the question? I think it's clear, what our priorities are. If we can call the question and have a vote on this.
Thank you, Bob. If there's no further questions or comments, there is a motion, and I believe it was amended and duly supported. So what I'm going to need is maybe Leanne, because I don't have everybody's picture here. If you could call, just by name. Let me just see if I can do the count here. Okay, I'm going to say all in favor.
Raise your hand.
Raise your hand. And Reno, I'm going to ask you to chime in.
Opposed.
Did you say opposed?
Yes, opposed.
Okay.
One at a time.
Just scanning. Okay. And the motion is defeated. Okay. Okay, if we move on now to
I didn't know what the motion was.
who was this? You want the motion? Leanne?
Would you like the motion?
Yes.
Tracy moved to put the motion forward that we resume testing or contract testing out.
And then there was
Do you want to do a roll for that? We had Tracy, had moved it, was in favor. I had Reno opposed, but I didn't see other hands that were either in favor or opposed.
just a second, Leanne. It was amended, that motion. Reno's comments.
Reno said that to defer until we find out what will be displaced.
I was offering it up as a friendly. I didn't know if Tracy actually, because if it was to defer, we could see back exactly what we were cutting. But I think Fabio's questions, sort of answered that question that we would be pulling from COVID response no matter where. So I mean, I don't think it matters at this point, but I mean, I guess it would be up to Tracy if it was friendly to defer, but I'm not sure it would change the outcome.
No, because if it's a deferral, I guess the point of order would be to vote on the amendment and then the motion in itself. And and if it moves forward on the amendment, then deferral, it means no more no more participation until the deferral is, in terms of the cost, and that information would have to be brought back. And we're talking now, next meeting is probably a month from now, which is the end, third week of August.
I'll actually rescind the deferral motion just because of that conversation. I mean, it'll be too late at that point by the time if we start, testing beaches in mid-August, the summer will be almost over. So I'll let Tracy's motion stand as is.
Okay, so I'll do it again. Then on the motion, and Leanne, for certainty, just bring forward that motion again.
The motion was put forward that we resume testing or contract testing out.
Okay, so that was moved by Tracy Bailey and supported by Gary Kashak.
Yes.
On that motion, if there's no further questions or comments, all in favor? Opposed?
Reno opposed.
That motion is defeated.
Defeated.
Okay, we'll move on to 10.1, resolutions from town of Essex, the spread of COVID-19 in our farm workers population. That's on page 17 of your agenda package. What is the pleasure of the board? We have a choice to adopt or receive or note and file.
I'll move receipt, I guess. I mean, just seems to be a nice awkward side, but move receipt.
Yeah, I think in terms of the timing of this, June 15th was prior to stage 2, and it seems to be redundant. So I would say, and certainly that the receipt of the resolution would be in order. So move by.
I'll second that, Gary.
Okay, thank you. Moved by Reno, supported by John, that we receive the documentation of resolution from the town of Essex. All in favor? Opposed, if any? That is carried. All right, members of the board, we do have, I need a motion to move into the committee of the whole for closed session in accordance to section 239 Municipal Act. Ed and Judy, all in favor? Opposed, that's carried. So we'll give it a few minutes and we'll make sure that IT is, we disconnect the outside world.